Thanks for joining me on my vlog today. Today we're going to be talking about social media and if you're not currently participating, when the proper moment to jump into it is. And I kind of say the word jump as more of a metaphor in this. Do you remember the game Double Dutch when you were a kid? It had the two jump ropes going and you had to time when you had to jump in. I thought it really worked well in this situation because you don't really want to jump into social media without kind of the planning, the forethought, the setup before jumping into that game. So today I'm going to be talking about 3 things that you do need to have set up before you do take social media and integrate that as part of your marketing plan. The first one I'm going to be talking about is having an employee policy for your staff so they know that they can participate in social media and the ways they can participate and how they cannot. It kind of sets up a nice guideline for your employees so they're not confused and they can interact, communicate, and really be a good spokesperson for your organization and provide more information than they can get sometimes from a website or from any other social situation. Really, to have your employees not be able to participate in social media, posting on Facebook, commenting on Twitter, is really detrimental to your organization. So I hope healthcare organizations reconsider that before going into social media. Secondly, the way that your patients reach you, the situation of a phone, email, internet, however they can connect with you to make an appointment, to ask a question, those situations really need to be set up in advance and you need to have it impeccable. You want to have that seamless transition from a phone call to an appointment and have that go in exactly the right direction you want, where you're not losing patients. It's a very seamless transition. So that needs to be set up as well. Finally, the third thing that needs to be set up is your information of how your patients can learn about you, basically your links. So when you do talk on social media, you can refer them to your website, your blog. All these things need to be set up beforehand and they need to truly reflect your practice and make sure that the message that you are sending is consistent, clear, and the information is very accurate. So those are the things that you need to set up. If there's anything more that you think is missing off this list, please let me know. I'd love to hear from you to find out what more thoughts you have and things that you really need to be aware before jumping into social media. Thanks so much for joining me today. I really appreciate it.